welcome to the next edition of Dr. Katie's Corner. Today we're going to talk about horse vaccinations. Springtime is the best time of year to get your horse up to date on especially their West Nile before the mosquito season and their tetanus before they get all frisky and cut themselves in the wire. So this is Injun. He's a 20-year-old paint gelding that's used for light ranch work, and we're here to get him up to date on his vaccinations. So when the veterinarian comes out to vaccinate your horse, they'll do a physical exam, and Melissa's going to start by taking his temperature while I talk a little bit about the vaccines he's going to receive today. So today he's going to get West Nile, which protects from West Nile virus, which we know we have here in Eastern Oregon. And he's going to get a second shot, which is tetanus and Eastern and Western encephalitis. Now, tetanus is a bacteria that they can get from getting cut or a puncture wound. So it's present in the soil, so it's always in the environment. The Eastern and Western encephalitis diseases are mostly on the East Coast, but we are seeing an increase in those diseases nationwide. And then lastly, he's going to get a combination of rhino and influenza. We've had increases in both of those diseases in the western United States in the last couple years, and so he lives in a place where he's exposed to a lot of other horses, so it's important for him to get that vaccine, whereas some backyard horses, it may not be necessary. So I'm going to do a physical exam on him, check his teeth, listen to his heart and lungs and his gut movements, do a visual inspection for lumps and bumps and anything that could be affecting him, and then we'll go ahead and vaccinate him today. You've got mosquitoes on you. Ooh, look at those old man teeth. Look at those teeth. They're all worn down. Do your teeth too, buddy. Ooh. So he looks healthy, and we're going to go ahead and vaccinate him today. I like to do the rhino on the right and the tetanus on the right so that we know which vaccines, if he has any soreness or reaction, we have an idea which vaccine is the culprit. So we'll start with his rhino flu. Oh, big guy. Good boy. And then we'll give him his tetanus combo in front of that a little bit. Good boy. And then we'll go ahead and give his West Nile vaccine on the left. I know. Alrighty, so he's all up to date on his vaccines, and the only other thing we could talk about as far as horse wellness in the springtime would be parasite control. So what we've learned recently is that some horses are higher shedders than others, and not all horses need the same treatment. So we recommend doing a fecal test on your horse to determine whether they even need treatment at all. So look forward to our next visit. Maybe we will do Injun's teeth.